Good evening, everyone. My name is Dr. Sangeeta Simlot, and I have with me our special guest today. This series of program that we have initiated, it's Doc Say Talk, meaning talking to the doctor for our American and Indian audience. Lot has happened over the past year, and we are still dealing with it. The entire world has uh, been suffering from the novel coronavirus, and there's a lot that we can learn from our past experience, a lot that we can offer to our friends and families in US and India and all over the world. Um, Dr. Sanjay Gupta is an alumni of All India Institute of Medical Sciences, New Delhi. He is also a Harvard-trained interventional pain uh, specialist and president of the American Pain Association. As a physician entrepreneur, he has also founded DrCircle.com, which is a leading web and social networking website for physicians with more than 16,000 physicians. That's really incredible, Dr. Gupta. He's also the executive producer of the award winning health TV show Health Time TV, featured in NBC Philly and ABC Live Well. And he has received numerous awards in his profession. And he is a great leader. And my association with him is through the Association of Indian American Association of Doctors, Physicians of Indian Origin. Dr. Gupta, welcome to the show today.
Thank you, Sangeeta ji, and definitely you have taken a great initiative. And good evening to all the viewers in US, and good morning to everybody in India. We're very excited to be here.
Indeed. Thank you. Thank you so much. We have a lot to talk about, and over these few weeks, we will be doing this series on a weekly basis, and this will be broadcasted live. Whatever you are seeing today is happening live. It's about 10 o'clock, 10 p.m. in US, and about 7:30 a.m. in India. So, a lot of questions, Dr. Gupta. Our audience has sent in advance that I would like to address, and hopefully you can help out with that. Um, America is recovering, of course, thanks to the vaccine drive, and uh, we COVID hit America a little bit before India, and now India is going through the second wave that we did back in September, November time. Fortunately, the vaccination came along, and then we were able to put it behind us in a way. I mean, we have um, the case rate has been declining in US, but in India we have but the positivity rate is really high. I'm not going to go into details of the numbers, but we just wanted to talk in general about what can we do to help our society. Um, one of the questions that was asked was, what would you recommend for household contacts of a COVID positive patient?
Right. I mean, that is a very important question because almost every household probably have a COVID patients, or may every household or every other household. And as you mentioned, prevention is definitely better than cure in this situation, because it is something we don't know how what the outcome will be in a particular given patient, so it's best to avoid it now. And I also feel that it's not just avoiding it one time. So it should be avoiding it as much as you can, because there is a quantitative value to this virus. And that's why doctors are kind of, a lot of doctors are, dying because they are repeatedly getting the virus. So
See.
it's not just one time exposure. I think the virus quantitative load makes a lot of difference.
Okay.
So my suggestion is that, if there is a patient who is confirmed positive, and even if you are positive, let's say, even then you should avoid repetitive exposure.
Okay.
So you should have that patient as much isolated as possible,
Okay.
and try to just understand, if you get 5 or 10 times the viral load, it will just increase your chances not only of getting the COVID, but also getting a severe COVID.
I see. So, in a way, if you get exposed multiple times to an infected person, your chances of getting infection go high.
Yes, and how close you were to that person when
Yes.
you got exposed.
Okay.
So if you're really close and you get this huge viral load on you,
G.
then it's even worse. I mean, you probably know that number of doctors who, even if they were young, the doctors who died were disproportionately high than normal population, because they're
It's,
getting so close to the patient,
G
and just the viral load is huge.
is huge. So, better to protect. And even if we live in a household with a lot of people, then it's better to put on the mask even at home.
Absolutely, because even if you, let's say you get exposed, and you first of all, if you have a patient, you should just put them in a room and as remain as much out of the room as possible.
Mhm.
Even if, let's say, you got one time and you say, well, I already got exposed, I don't have to worry about it. No, as I said, the repeated exposure will make a lot of
Repeated
difference,
exposures, right?
and how much distance you keep in that exposure will make a lot of difference.
That is
So
true. So that's a very good advice to people who have close household contact. So keep your social distancing even while you're living in the same house. Keep your social distancing and the mask and frequent hand washing and sanitizing. That's really important. Okay.
and
Um,
put double mask. You don't have to just put you don't have to put single mask, put double mask,
Double mask, right? And
just
surgical mask and mask with better
yeah.
uh, protection. Um, the other question that came about the convalescent plasma, how beneficial is that? कितना ये जो plasma therapy, I know बहुत ज़्यादा it's like a talk of the town कि plasma चाहिए. मैं Facebook पे भी काफ़ी देखती हूँ कि लोग प्लाज्मा के लिए ढूंढते रहते हैं कि हमको प्लाज्मा चाहिए तो ये इसमें कितनी सच्चाई है कि ये प्लाज्मा जो है वो हेल्प करता है.
Well, I mean, I think, as you know, plasma is passive antibodies. So
हाँ.
I think it is definitely helps,
Mhm.
and we have seen in a lot of cases here. But the question is, when is it given?
Mhm.
Now, the advantage of plasma, it is that uh, it has lesser side effect profile compared to corticosteroid, and it's the uh, benefit to harm ratio is much better than any other thing, pretty much.
Okay.
Even cortisone, steroid. So plasma is pretty much harmless thing. I'm not saying completely harmless, but it's very harmless.
Hmm.
And my advice will be to get plasma as early as possible
Okay.
if there is access to it.
Okay.
President Trump got it within 24 hours when he got the thing.
Right.
He got the antibodies,
The monoclonal, huh?
monoclonal antibodies.
Right.
But plasma, I think, is definitely, it's a good thing to have. But again, if the disease has gone into the vicious cycle of cascade, then it may be too late to give anything.
Right. So
You know what I'm saying?
early on, it's the right treatment at the right time.
A right treatment at the right time. Plasma will be one of the things that can
Mhm.
be given early. because rather than giving steroid early, now problem with steroid give that you are seeing in India, mucormycosis is going crazy
Mucormycosis. Right, right.
because these people are getting immunosuppressed
Suppressed.
zone and steroid are bringing too early, and sometimes they are actually making the COVID worse. Plasma really won't make the COVID worse, number one.
Hmm.
Number two is not causing immunosuppression. It's a very specific antibody. So
Okay.
I personally feel that plasma is a good thing to have. Now, if it, I think, in my opinion, it should be given earlier than later.
Okay.
It may have
Okay.
better chances.
So early on is okay. The other question that was asked is about getting COVID and then getting vaccinated. Should one take a vaccine when they recover from COVID and when? I know CDC here recommends differently than um, or Indian the health advisory.
So, if a patient has been infected, sorry, I missed. So, if a patient has
हाँ,
been
if the
infected,
patient
should
has
they?
been infected, let's say कोविड किसी को हो गया है, तो
Mhm.
उसके कितने टाइम बाद वैक्सीन ले सकते हैं?
Um, well, there are some of these questions I don't think anybody knows the answer to, right? That's the problem with these vaccines. They have been launched within a year, and so we don't have a lot of, I will say, very informed answers. Whatever we are doing is guesswork, right? Now,
जी.
patient has had COVID, so patient probably has antibodies in the system,
Mhm.
uh, and I mean, I think I personally feel that it doesn't harm to take the vaccine. Now, how much benefit it will provide, we don't know. But I mean, I don't see a harm in taking the vaccine at any given
Right,
time. If you have access to it, just might as well take it.
right.
I
Uh,
don't think time will make a difference because there's hardly any choices right now. So if you
right.
have a time schedule, you didn't plan, you have a date scheduled for
Mhm.
vaccine, might as well just take it.
Right. So I think in CDC recommends that once you recover from COVID, 14 days later, you can take the COVID vaccine, which is the messenger RNA vaccine in US. And if unless you received monoclonal antibodies, then you have to wait for 90 days. Um, Indian vaccine, their guidelines are that you have to wait for 90 days. They say about 3 months wait after you get infected. It could be because the immunity lasts for that long from COVID infection. That's why they want to get the benefit from the natural immunity and then take the vaccine. But again, it's such a new virus that not many people know what is advisable for those patients. And of course, the guidelines will be different in US and India. The next question is along the same line. It's about getting infected between the two doses of vaccine. तो कई लोगों को होता है पहला डोज ले लिया, फिर उनको सेकेंड डोज की वेट कर रहे हैं एंड देन बीच में इन्फेक्शन हो जाता है, तो उनके लिए क्या करना चाहिए एंड व्हेन दे रिकवर शुड दे जस्ट गेट अ बूस्टर या फिर पूरा सीरीज दोबारा लेना चाहिए?
I think they should just get a booster, if they had it, and then they got the COVID, and there are a lot of patients who are like that.
Mhm.
So I personally feel that might as well complete the course of the vaccine.
Let's get the booster.
Yeah, get the booster and see. I mean, vaccine itself, is also is pretty safe. So I think um, that getting it, we still do not know how long the natural immunity lasts. I have seen patients who had COVID and then they got better and they got a repeat COVID within 6 weeks,
Right,
right? And so, I mean, it is, so the claims that it provides immunity once you have it for 3 to 6 months. I don't think anybody knows answer to those questions.
right, right.
And so having a vaccine, if you have access to it, I'll rather take it than don't not take it, right?
Okay.
No
That
matter
makes
what time and what, because we don't know like how long the immunity lasts. What we are seeing is that there are patients who got the COVID and they got repeated COVID. A lot of doctors got it.
a lot of
Lot of-
doctors. Some have become positive maybe two, three times. Uh,
yes,
because as you said कि जितना exposure होगा, जितनी बार exposure होगा, उतने आपके chances बढ़ते जाएंगे to
exactly.
contract COVID. So I think, well, uh, we always hear about that quote that an ounce of prevention is better than a pound of cure. So prevention is definitely better than the cure,
Oh yes.
right?
Any amount of prevention is definitely work in this, because even if it doesn't make you 100% COVID proof, but the fact if you have less viral load, most likely you will have a lesser intensity of, disease, even if you get it.
That is true. That is true. एक सवाल आया था वो इंडिया से है कि somebody has family member who has COVID and they are being treated as an outpatient. Milder illness है तो कई outpatient they are just quarantining at home. Now household contact है तो can they even though they don't have any symptoms और उनको कोई problem नहीं है but they have come in contact with the COVID patient at home, can they go outside in the community? Lot of people I have seen also कि घर में किसी को COVID हुआ है and they are going to the mass vaccination site to get themselves vaccinated. What would you recommend to those household contacts?
Well, I mean, asymptomatic, as you know, doesn't mean anything in this, right? That we don't
Agree.
know their carrier of the virus. That's the biggest problem with this virus, is that
Mm-hmm.
it kind of floats undetected, right?
Right.
And uh, probably is highly infectious, and especially this Indian variant may be much more highly infectious. And the fact that there are asymptomatic carriers for this, that is the worst part. So the
That
person
is
who
the
has it, they may not even know they
right.
have it, and they're giving it to 10 other people or spreading in the air, or
Right.
so I personally feel that if somebody has a close contact with a patient, um, they should just consider they are positive, right?
Okay. And
Unless, right,
quarantine करना चाहिए उनको.
and just be careful, and take double precaution, wear double masks, and take all the precautions. And um, I mean, if they get tested, it may or may not show sometimes.
Mm-hmm.
I don't know how much is the accuracy of that these tests either are, um,
True.
how well they are being performed. But it,
Right.
it doesn't it doesn't harm to take extra precaution, especially if
Right.
you have been exposed
Mm-hmm.
to, especially in a country like India right now, whereas basically it's a uh, community spread, right?
True.
It's pretty much in the air right now.
Hmm.
So
Right.
it
It
is
is
better to
airborne
just to whatever you can do to reduce the viral load in the air will be helpful.
राइट सो दैट्स अ गुड सजेशन कि किसी को कांटेक्ट है घर में किसी को कोविड हुआ है तो जस्ट क्वारंटाइन योरसेल्फ आल्सो एज मच एज यू कैन and even if you go out, put on your mask, face shield, whatever you have to do to prevent others from catching the infection because
Right, right.
you may be spreading it, you may be spreading the
Another
virus.
thing is, as I said, if you have a mild case and you get from somewhere else, you get a double dose,
You got to
right?
do those. That is true. That is
So
true.
might
That's
as
a bit,
well, you
yeah.
already have something going on, just take extra precautions. I
Right.
mean, I'm not saying that you have to completely, shut yourself in a room, but at least be cautious
Be
in terms of,
cognizant. Yes, be cautious about it, that you can be spreading the infection. So
and you can be getting double dose of infection,
that is
right?
true. That is true. एक
Just
घर
stay,
पे मिली
rather than
तो
sitting very close to a person, sit maybe a
right.
little bit further apart,
जी,
mask and
बिल्कुल, बिल्कुल। तो जितना प्रोटेक्शन ले सकें उतना अच्छा है। One question is coming that's live. Can you comment on the spectrum of neurological symptoms that people display as a result of long COVID? So किसी को protracted illness हुई है, um, so uh, Karthikeya Tripathi ji is asking that question. Um, Neurological symptoms क्या हो सकते हैं from prolonged COVID infection?
well, I mean, we all heard about that it has a lot of cranial nerve involvement,
Hmm.
especially smell and taste, even
Right,
early,
right,
right, without any other symptoms.
right,
So that is one thing we should keep
right.
in mind. And then,
क्रेनियल का मतलब मैं अपनी ऑडियंस को बता देती हूँ। क्रेनियल का मतलब जो ब्रेन की नर्व्स होती हैं, ब्रेन।
right, to brain cleaner, so it
जी,
goes directly to the brain,
डायरेक्टली,
bypassing the lung in many
राइट,
cases,
राइट।
right?
हुँ, हुँ,
And and then it can cause, once it goes to the brain, it can cause headache, cause meningitis, can stroke. I
हुँ, हुँ,
mean, there are young, especially in younger population, uh, there were, youth which died because of cranial involvement, because of
हुँ,
brain involvement early
वाओ,
on,
वाओ।
and they were otherwise healthy. They never had a lung problem. They had headaches.
हुँ, हुँ, हुँ,
I remember there was a patient, like almost like 30, 31 or 31-year-old in New York, and had a COVID, and he came home, recovered pretty much. He had a mild case, came home after a day, just in the observation, and then after 2 or 3 days, so his parents went to get shopping, grocery or something. They came home. He was dead. He was only complaining of headache that day morning, and he was dead in the afternoon.
वाओ! It's a very
So,
fulminant infection he got.
so
But
sometime the cranial involvement is very, something to be. It can be extra deadly when they have cranial involvement.
mhm,
It can be anything as headache, nerve palsy, and other thing is sometimes they are developing uh, symptoms, stroke kind of symptoms, as you
right,
probably
right,
notice many patients, they are developing thrombogenesis
right.
and those
Clotting,
kind of,
yeah.
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 That is also being seen, especially the patients who are going on ventilators. They are developing more cardiovascular, I mean,
Cardio.
cerebrovascular
Mhm.
symptoms as well.
Right, right. Gyanbare also I've heard that not many
Yes,
cases, but some.
yes.
So in layman's term, like paralytic illness of the lower extremities. Um, the other question is that is there any role of vitamins if you have COVID? तो कौन से vitamins लेने ठीक रहते हैं? Um,
Well, I mean, um, that is, first of all, I don't think anybody really knows about that. We can't tell whether the vitamins help or cause harm, right? We don't know that because there is no
So
studies.
just
But
a good old C
right,
for vitamin C. I mean, they talk a lot about the vitamin C, vitamin D, and the zinc combination. So maybe just immunity booster, like we do it for any other illness, not particularly COVID. किसी भी illness के लिए just immunity
yes,
booster vitamin अगर लें तो कोई
and
harm नहीं है, but if they help, we don't know.
you can do. I mean, I don't know. It'll help. They can do like vitamin E or something to help with the clotting, because thrombogenesis is very, clotting is
Mhm.
increased in these cases. So they
जी.
can probably look into, fish oil or vitamin E and those kind of
Mhm.
things that help
Mhm.
reduce the, you know, thrombogenesis.
Right,
That may be helpful, but
right.
it is just. I don't think vitamins will make a huge difference the best thing is to avoid as much viral load as possible.
Right.
That is my feeling, and it's because you can be taking loads of vitamin,
Mm,
but if the viral load is too much, I don't think it's going to make any difference,
right.
right?
सो ये क्वेश्चन प्रोफेशन से जुड़ा हुआ है। एक सवाल आया है कि गिवन द रिपीटेड एक्सपोजर यू हैव, how are doctors such as yourselves protecting yourselves and your families through all this? So um, I know, Dr. Sanjay, you have gone through this. We have all gone through the uh, protocol and the PPEs and everything. I know. Remember, just to answer to your question, um, when I had COVID at my facility, so for that time period of 2 to 3 months, I would take a change of clothes. I will just go in all covered up, top to bottom, inside. Before I left the facility, I'll change my clothes and then cover myself up in a brand new set of clothes and whatever I had to do to cover myself top to bottom, and then come home, throw everything in the washer, shower, had to toe clean up, and just I wore a mask at home. I did not come closer to my family. I remember they were um, uh, for even my daughter. I did not even touch her for those 3 months while I was taking care of COVID patients, and that idea did crossed my mind that I should just maybe put up a tent outside my house or just check into a hotel so I don't expose my family to that. So I know that a lot healthcare professionals have done, Kartikeya ji, and some people actually, I know in New York when it was rampant, some people have actually camped out in their yards, slept in tents, and some checked into a hotel. We have friends who did not come home for 8 months, even back in India. They did not come home until the first wave was over. So, a lot of things people have done. We have been successful. We have failed, and lot has happened over the year. So,
Yeah,
yeah,
and I agree. I mean, I think, I mean, early on, I don't know if you remember in China, it happened so suddenly. A lot of doctors died there because they were working around the clock.
yes,
And they were getting so much repeated exposure. Now here, I mean, although New York, we saw a lot of deaths of doctors.
yes.
By the time, I think doctors get this, like you said, doctors got this idea of, taking breaks, taking complete precaution, and that probably helped the number of doctors death decrease after that.
That is true. That
What
is
happened to China, Italy, New York, it was much less other places.
true. That is so true. All right. Well, thank you so much, Dr. Gupta. It was a pleasure and an honor to have you here. Or if we are lucky enough, we will have you back on the show as and when you are available to uh, talk more about the COVID pandemic, which is the uh, talk of the town. I mean, it's a burning question these days, how to put this behind us. So ये बातें भी जारी रहेंगी, and thank you so much for coming to the show, Dr. Gupta. Thank you.
Thank you, Sangeeta ji. Thanks for having me, and wish you best for in all your endeavors to educate, in this rough time. And great. Thank you. Good
Thank you
night.
so much. Good night. Thank you so much. So now we have Dr. Arvind Mathur from Jodhpur joining in. Arvind ji, आपका बहुत बहुत स्वागत है, Dr. साहब. Thank you so much for early morning talk on.
It's my privilege, really, Sangeeta ji, for giving me this opportunity. ये मेरा सौभाग्य है
नहीं, ये
कि
सौभाग्य तो मेरा है, डॉक्टर अरविंद माथुर। मैं आपको आई नो जोधपुर वाले तो सब आपको जानते ही हैं। यू आर a known name in Rajasthan, you are a known name in India. So आपकी जो wisdom है उससे बहुत लोग benefit कर सकेंगे, और ये कोशिश यही है कि क्योंकि अभी सारी दुनिया जो है इससे जूझ रही है, और जितनी इंफॉर्मेशन हमको मिल जाए थ्रू एन एक्सपर्ट, मैं समझती हूँ कि उससे हमारी जो कम्युनिटी है उसको बहुत फायदा होगा. तो आई एम रियली ऑनर्ड कि आप यहाँ पर आए हैं. फॉर आवर ऑडियंस मैं उनको बता देना चाहती हूँ कि डॉक्टर अरविंद माथुर is a general physician in Jodhpur, और करीब 35 साल से 35 प्लस इयर्स से वो मेडिसिन की प्रैक्टिस कर रहे हैं. ही इज द एक्स प्रिंसिपल ऑफ SN मेडिकल कॉलेज जोधपुर. Excellent academic career, and has been the recipient of the award of Talent Search Scheme Senior Research Fellowship by Indian Council of Medical Research during his studies, which is a very, very credible award to have. Extensive training in various frontiers of the medical field. Dr. Arvind Mathur, he has even served as the Inspector for Medical Council of India, and is also a member of the Technical Resource Group of NACO. I'll have to ask you what that is. And various other national consultative committees for the healthcare of the society. And he's currently the director of his most recently launched project, which is ACMERI, ACMERI, which is the Asian Center for Medical Education, Research and Innovation. The aim of the organization being to work for improving health of people of Asian continent by imparting medical education, conducting research on relevant health issues, and developing innovative ways to improve healthcare delivery. So, डॉक्टर अरविंद, बहुत बहुत आपका स्वागत है यहाँ पर. काफ़ी लोग वेट कर रहे हैं आपकी एक्सपर्ट ओपिनियन सुनने के लिए. आपने ये फर्स्ट हैंड देखा हुआ है इंडिया में जो कोविड चल रहा है, और उसके लिए अगर आप हमें कुछ एडवाइस दे पाएं. हमने ऑडियंस से पूछा था कि उनको कोई क्वेरीज हैं जो वो पूछना चाहते हैं. सो व्हाट who better to ask than to you about questions coming from India and talking to an Indian expert.
Thank you, Sangeeta ji, for asking me to do this job. मैं आपको पहले आउटसाइड पे बता दूं कि कोविड के लिए as a physician also we are learning every day.
जी.
This has been a new learning for all of us in all these years, in all these 1.5 years or so. So every day something new is coming up, and what we thought initially proves correct or wrong over the period of time or so.
जी.
So this has been a learning experience, and I think interacting with our colleagues and with our citizens would always help us also, because it's going to educate me also about when you try to discuss certain issues.
That is true. That is so true. It's like trial and error.
Yes.
Even when we started with COVID in USA, I remember the hydroxychloroquine was like the goddess of all medications. It was so sought after. लेकिन फिर पता चला कि no, it's not hydroxychloroquine, it's steroid. Then monoclonal antibodies came along. Then the plasma came along. So बहुत सारी चीज़ें हैं. So डॉक्टर अरविंद माथुर, आप इंडिया में ट्रीट कर रहे हैं, और lot of times we are also treating as an outpatient also. तो आउटपेशेंट के लिए इफेक्टिव ट्रीटमेंट मोडालिटीज क्या हैं, एंड कब वो शुरू करना चाहिए?
ये मेरी प्रैक्टिस आजकल मेनली आउटपेशेंट पेशेंट्स की है, बिकॉज बीइंग इन सर्टेन एज ब्रैकेट दे आर नॉट परमिटिंग अस टू बी पार्ट ऑफ एक्टिव हॉस्पिटल मैनेजमेंट आल्सो.
जी.
आउटपेशेंट मैनेजमेंट बहुत क्रूशियल और इम्पोर्टेंट है कोविड के लिए,
जी.
because these initial days are very important, and we cannot keep all the patients in hospital also with this disease. And as you look at the disease, most of the persons, 80% would get well with this modality of treatment as such.
जी,
मैं जब भी कोई पर्सन कोई कोविड रिलेटेड सिम्टम के साथ में प्रेजेंट करते हैं,
जी,
तो सबसे पहला टास्क हमारा ये होता है कि ये हम इन प्रेजेंट डेज हम ये मान के चलते हैं कि उसे कोविड है, बिकॉज देन वी आर गोइंग टू आस्क फॉर द टेस्ट और विल गेट अदर इन्वेस्टिगेशंस
जी,
डन, बट फ्रॉम दैट टाइम इटसेल्फ हम उसे एज अ कोविड पॉजिटिव ही मान के चलते हैं।
जी,
और उस समय जो हमारा ट्रीटमेंट के जो मेन ऑब्जेक्टिव्स रहते हैं, एक तो ये है कि उस पेशेंट को रिलीफ मिले, उसके
जी,
सिम्टम्स से उसको आराम मिले।
जी,
सेकेंडली, वो दूसरों को ट्रांसमिट ना करे डिसीज,
दैट इज़ वेरी इम्पोर्टेंट।
दैट इज इम्पॉर्टेंट,
हाँ जी,
बिकॉज उससे हमें ये बचाना है कि वी शुड नॉट ट्रांसमिट द डिसीज ऑल्सो।
जी,
थर्ड, जब आउट पेशेंट में मैनेज कर रहे होते हैं, तो एक इम्पॉर्टेंट चीज ये होती है कि हम उसके जो वार्निंग सिग्नल्स हैं उसके बारे में क्लीन ऑब्जर्वेशन रखें, so that we know when we have to intervene or when we have to ask them to get into the hospital or for further treatment also.
जी,
So ये objectives के साथ में when we start, so first and foremost thing which I usually tell them is to isolate them.
आई
That
सी, ओके,
important. That is most important because they, with explanation कि why should they do it? Because
जी,
हमें उनको बताना जरूरी है कि
हुँ,
आप इस तरह से इस डिजीज को स्प्रेड कर सकते हैं
हुँ, हुँ,
to your near and dear ones.
जी,
So that is why it is important for you to isolate yourself. Isolation का देखिए, हमारे यहाँ पे इन मेनी सर्कमस्टांसेस इंडिविजुअल रूम नहीं अवेलेबल होता है कुछ लोग,
जी,
कुछ
जी,
फैमिलीज में।
जी,
In that case, we usually ask them that they maintain a distance of 6 to 8 feet from them, keep double mask
घर में
पर
भी रखें,
घर में रखें,
जी,
घर
जी,
में रखें, बिल्कुल
जी,
आइसोलेशन में जो है। So that is one. So isolation is first and foremost thing which
जी,
I usually
जी,
advise. Second thing which I advise is a rest.
ओके,
What I feel that during this early viremic phase, any kind of physical exertion would worsen the problem.
आई सी,
So usually ask them to take rest, relax and rest.
जी,
That's the only thing which they should do
जी,
at this particular time. And third most important thing which we emphasize is hydration. I
ओके,
usually, because in our climate, hydration is an important thing, and we I insist
जी,
upon them to maintain good hydration by keeping their fluid intake to the maximum possible.
ओके,
Because
ओके,
uh, dehydration in our setting is going to cause havoc in these particular patients
जी,
because because of the vascular issues, etc. Everything. So hydration, rest, and isolation.
हुँ,
These three are mandatory guidance to these patients in outpatient.
जी,
Now, regarding drug treatment, that is the most important problem
जी,
because we do not have access to monoclonal antibodies to be administered for the mild cases, which
जी,
hopefully India is going to get it by this month end, or maybe
वेरी गुड, दैट्स
I think they have given authorization, and hopefully it should arrive sometime in by this month end.
हुँ,
So monoclonal antibodies are out. Plasma has gone to backstage now. It is not being recommended, and it's not possible for all mild cases to
नॉट
receive that.
पॉसिबल, राइट,
Yes.
गेट इट
So
राइट अवे,
the important thing is that we give them symptomatic treatment with the use of paracetamol for their pyrexia, and
जी,
in case if need be, some low doses of NSAIDs could also be given to them. Then, in addition to this, many a times for their cough or their coryza-like symptoms,
जी,
we use anti-allergic drugs also. Or
ओके,
cough sedatives are also
जी,
being used for them.
जी,
Now, in addition to this, what is going on over here is use of lot many antibiotics and drugs of doubtful utility,
हुँ, हुँ,
because you'll see that, and due to social media and the communication amongst the patients itself, many a times when patient calls us, he would just say that I've already started those drugs. which have been in vogue, may it be azithromycin, may it be
एजिथ्रोमाइसिन का
doxycycline,
बहुत सुनते हैं
azithromycin
डॉक्टर।
or doxycycline, ivermectin, these drugs
हाँ।
are, they would use them basically.
हम्म।
At that time, uh, just not to confront the patient, we just say that, okay, stop after 3 days or so. That is what. So,
ओके।
but these drugs are being used, but their utility is doubtful.
इज
We
डाउटफुल।
do not have, yeah, we do not have monoclonal antibodies, but only recommendation is of symptomatic treatment of
हाँ।
paracetamol or antitussive drugs.
जी।
And with this, we give them the warning signals, which about which they have to be watchful.
राइट।
And and the warning signals, as are mentioned, are shortness of breath. If you have,
हाँ जी।
अगर आपको सांस की कोई परेशानी लगे,
हाँ
आपका बुखार अगर बहुत तेज हो जाए और
जी।
कंटिन्यूस रहे,
जी।
that is another thing. If you
जी।
feel weak or if you feel dizzy or so, तो ऐसे जो लक्षण अगर किसी को होते हैं, you, in that case, you should immediately contact your healthcare provider or
जी।
the hospital. Luckily, many persons are having access to pulse oximeters
हाँ,
in
अभी काफ़ी
nowadays.
हो गया है विद
Yes, yeah.
ऑनलाइन
Even
बाइंग
in,
ऑल्सो, तो वो
yes,
उसमें कोई नंबर है दैट
yes,
जनरल
yeah.
पॉपुलेशन शुड बी लुकिंग फॉर कि किस
Yeah.
नंबर पे अलर्ट हो जाना चाहिए उनको?
So I think whenever somebody has infection, we need them to have a thermometer to check their temperature.
जी।
So they should keep monitoring temperature at least 4 times in a day or so.
जी।
And pulse oximetry, if used properly in a warm finger, if they use it, we want a saturation. It shows pulse oxygen saturation and
जी।
the pulse rate also.
जी।
So they need to have a saturation beyond 94.
94।
In
ओके।
94, 94 is the figure. 94 and above is acceptable. If
ओके।
it goes below that,
जी।
then they have to report. That is one thing.
ओके।
Secondly, even we have seen that those who were maintaining 98, 97 earlier, and they suddenly start having 94, 95,
हम्म।
then also I ask them to report to us in case if you notice a dip
एनी
in the
चेंजेस,
oxygen,
एनी
any
चेंजेस
changes.
शुड बी।
And if the pulse rate is more than 110 or 100, or
अच्छा।
110, 120, then also they should report.
ओके।
One underutilized thing uh, for the clinical practice is respiratory rate. What I feel,
राइट।
ये एक बहुत ही सिंपल और अच्छा गाइड
हाँ।
है हमें ट्रीटमेंट के लिए,
हाँ जी।
और इसको हम जब पेशेंट्स को जब समझा देते हैं,
हम्म।
particularly agar, in case if there is a caregiver for the older patients or so,
जी। जी।
then it also helps us.
जी।
Agar respiratory rate is beyond 20, you have
हाँ।
to be watchful, and if it is beyond 30, you have to contact the doctor.
राइट।
So,
सो मतलब जो
I,
जितनी 1 मिनट में कितनी सांस ले रहे हो, 20 से ज़्यादा है तो थोड़ा अलर्ट हो जाना चाहिए, और 30
yes,
बार 1 मिनट में सांस ले रहे हो तो डेफिनिटली दैट्स अ डेंजरस साइन। ओके।
so I think these things, they help us in managing patients and outpatients basically.
हाँ जी। जी। तो इज़ देयर एनी राइट अमाउंट ऑफ ऑक्सीजन की अभी काफ़ी उसका ऑक्सीजन कंसंट्रेटर का और घर में ऑक्सीजन रखने का भी काफ़ी
So,
चल रहा है। व्हाट्स योर
yes,
ओपिनियन
yeah.
ऑन दैट?
अभी definitely it's painful to watch this type of news item also. Uh, Oxygenation is important thing for management. ये
जी।
जो patients हैं कोविड के,
जी।
इनके लिए ऑक्सीजनेशन बहुत important है, and what we have seen that ये disease का जो effect on the body is such, it causes a great change in the oxygen exchange system of the body. तो
जी।
इसमें जो है, जो important जो problem है वो low oxygen है.
जी।
Now, uh, to manage that, the only thing which can help us is supplementing oxygen.
सप्लीमेंटल ऑक्सीजन। जी।
So, so now these concentrators, they could be useful in very mild situation of hypoxia, say when you just needed oxygen, around 3 to 4 liters of oxygen per minute to maintain your
जी,
saturation beyond around 92, 94.
जी,
Okay. When if somebody has got a dip in oxygen level, and if we start usually supplementing them oxygen with a very low volume, maybe 1 or 2 liters of oxygen, and if they maintain their saturation around 94, because we with oxygen we do not want to go beyond 96. There's
ओके,
no point. There's no
ओके,
point that we increase oxygen and reach 97, 98 target. No, it should not
अच्छा,
go beyond 96
96
with
तक
supplement.
आ गया है तो
96
उसके
होगा,
ज़्यादा ओवरडूइंग भी
वो
ठीक नहीं है,
वो
ओवरडूइंग।
भी ठीक नहीं है।
तो ये घर
Now,
में जो ऑक्सीजन यूज़ कर रहे हैं, उनके लिए बहुत इम्पोर्टेंट है कि आपका अगर ऑक्सीजन सैचुरेशन 96 तक पहुँच गया, अगर 1 या 2 लीटर पे, तो आप उसको बढ़ाइए नहीं ऑक्सीजन का लेवल, वहाँ पर
yeah,
रहने दीजिए। ओके,
but these concentrators will not be useful for the severe cases.
जी,
Because there the oxygen requirement is
वही
very
हाँ,
high.
जी,
Because we need to use high. Now, at this point, because we are primarily now concerned about the home management part only, because in hospital the oxygen is being administered through high flow nasal oxygenators or the other ways of rebreathing cycles, etc. That is all right. But in home, when you are maintaining oxygen concentrator, the important thing is maintaining a good cleanliness and good care of the oxygen concentrator itself.
ओके,
Because what we are seeing now is the fungal disorders occurring where the probably oxygen administration is being blamed, because the
ओके,
oxygen tubings,
ट्यूबिंग एंड ऑल। हुँ,
yeah, the water which is being used for humidifying, etc.,
हुँ,
they are all being blamed for probable fungal infections, basically.
आई
So
सी,
one has to be watchful about that,
वेरी
about the
केयरफुल,
taking care
राइट।
of the oxygen concentrators also.
क्योंकि कॉन्सन्ट्रेटर भी कई बार ऐसा होता है कि एक घर में कोविड ठीक हो गया है, तो वो कॉन्सन्ट्रेटर दूसरी जगह चला जाता है। तो
Yes,
that will contribute to not only spread of the infection, but also fungal infection, as you mentioned.
yes,
It's
yes.
very common unless you sanitize it. तो recommendation तो यही है कि अगर जितना हो सके उसको एक से दूसरे में अगर ले जाएँ तो बहुत साफ-सफाई करके फिर किसी और
Yeah,
को दें। जी,
yeah, they should be having a disposable tubings. That is one thing. The
जी,
one tube from one patient should never be used to the other.
जी,
The water bottle should be cleaned with hypochlorite solution,
जी।
and then only use RO water or a
हुँ,
distilled water
हुँ,
over there,
हुँ,
because that part is very important,
very
because that is
important।
important. and
हुँ, हुँ,
and oxygen concentrators may help us in milder cases or those who have come back from the hospital on a low flow
हुँ,
oxygen. For
यस,
in those cases it would be
यस, यस। एंड स्टेरॉइड्स कब यूज़ करना चाहिए? आउट पेशेंट में है, आई नो वो दैट्स
yeah,
आल्सो
I think this is a very important thing, very important thing. One thing I usually tell our medical colleagues also in the general practice or in the primary care levels, etc. Steroids not to be used in the first week of the disease. That is one thing very
ओके।
clear.
तो ये बहुत अच्छी
But
बात आपने बताई कि पहले हफ्ते में बीमारी के स्टेरॉइड्स नहीं यूज़ करना चाहिए।
it is not to be used.
हुँ,
Later on also, its use is limited to certain circumstances, and
जी,
that too for a shorter duration.
जी,
वो circumstances में usually अगर ऑक्सीजन लेवल्स कम होना शुरू होते हैं तो
जी।
that is one,
ओके,
because
ओके,
that is one important indicator we may have to use steroids. But there are certain circumstances where other inflammatory problems, like agar fever persists beyond 7 days or so, and a
जी,
high grade fever is there, the markers which we test during that time, if they are high, then there are people who use low dose of steroids to give symptomatic relief or so. In that case, also it has to be used for a very short duration
श्योर,
and in a very low doses as such,
जी,
as far as possible.
जी, जी,
Because There are two things. Basically, in the studies, they showed that dexamethasone improved mortality. Now, the message which went to the primary care practitioners was that steroid is useful, and they started prescribing on day one also.
डे वन जैसे ही पता चलता है कोविड का डायग्नोसिस हुआ स्टेरॉइड्स
And
शुरू हो
steroid is
जाते
the first thing. And
हैं
you see prescriptions with so many drugs over there. There we have to, I think we are trying to tell people wherever the forum is there to
हम्म
ask them not to use steroids in the first week at least.
ओके
And if it is used, it has to be used for a shorter duration and in a lower doses as such.
ओके अगर फर्स्ट वीक में किसी को या तो देर से पता चला है या फिर फल्मिनेंट डिजीज एकदम से हो गई है उनको विद इन द फर्स्ट वीक तब शायद ट्रीटमेंट उनका थोड़ा सा
Yeah,
डिफरेंट हो जाएगा
yes,
देन यू हैव
yeah.
टू
In the, then they have to go. Then they have to be under the care of the hospital. With
जी
in that circumstance, of course, we will be using antivirals and if
जी
needed, uh, steroids and anticoagulants, etc. Everything has to be used
हाँ
basically.
एंटाकोएगुलेंट्स आल्सो राइट वो जो
Yes,
ब्लड थिनर
blood thinners
ऑडियंस
का
को
भी.
बता देते हैं जो ब्लड को थिन करने की दवा होती है वो ज्यादा बढ़ी हुई अगर इलनेस है तो उसमें हम लोग यूज कर सकते हैं दैट्स गुड एक सवाल आया था कि किसी को कोविड हुआ है पेशेंट को तो कितने दिन बाद वो आइसोलेशन से उनको निकाल सकते हैं
देखिए, आइसोलेशन का हमारा पर्पस था कि ये पेशेंट जो है दूसरों को ट्रांसमिट ना करे. दैट
जी
इज वन थिंग.
जी
इसके लिए जो हमें ये देखना पड़ेगा कि जो इन्फेक्शियस पीरियड डिजीज का जो है
जी
वो इस आइसोलेशन से कवर हो जाना चाहिए.
ओके
इन्फेक्शियस पीरियड जो है अनफॉर्चुनेटली डिजीज मैनिफेस्टेशन के पहले शुरू हो जाता है,
जी
तो वो एसिम्प्टोमेटिक फेज को हम कवर नहीं कर पाए. बट ये जो फेज है यूजुअली बाय 7 to 8 days ये फेज कवर हो जाता है. बट टू बी
जी
कॉशियस, देर आर रिकमेंडेशंस कि इंडिया में जो रिकमेंडेशंस हैं वो 14 डेज की है. From the
ओके
day you test positive, 14 days is the time which is needed for completing the isolation. But
जी
usually CDC guidelines are about 10 days basically. So
10
after
days
10 days, they recommend that one can come out.
कम आउट
Then after also, I usually recommend them to have continue to use mask
जी
for themselves and keep maintain a distance because that is you needed otherwise also.
जी
So
मास्क
okay,
तो अदरवाइज भी चलेगा ही चलेगा अभी मास्क से तो अभी
it's a
कोई
part
राहत
of life.
नहीं
Yeah,
है इट्स अ
yeah,
पार्ट ऑफ
yes,
लाइफ
yeah.
फॉर द टाइम
No
बीइंग
part of
या
yes.
जी सो एक सवाल आया था वो इंडिया से आया था और वो मिस्टर भवेश जोशी जी ने पूछा है तो आई डोंट नो इफ भवेश इज वाचिंग द शो और नॉट तो उनका खुद का एक्सपीरियंस है जो उन्होंने बताया है और उसके बेसिस पे उन्होंने सवाल पूछा है कि my confusion regarding the second shot of Covishield vaccine. I received my first shot on 8th March, and this was followed by Corona on 22nd March. So it was about 2 weeks after he got the shot, Covishield, he got sick and he stayed in the COVID ICU receiving aggressive treatment. Discharged on 3rd of April. So करीब 12-13 दिन वो अस्पताल में रहे. And there are different opinion as to when I should receive the second shot. So please throw some light on this and guide me. तो भवेश जी
I
आपका
think it's
सवाल
an
डॉक्टर अरविंद से मैं पूछ रही हूँ कि ये
भविष्य we feel that आपको काफी परेशानियों से पार गुजरना पड़ा. So but good that you are out of all that. चूंकि आपको हॉस्पिटलाइज भी होना पड़ा ट्रीटमेंट के लिए और आई थिंक ड्यूरिंग द सीवियर इलनेस प्लाज्मा वगैरह का भी यूज किया जाता है. अगर मान तो इन दैट केस यूजुअल रिकमेंडेशन रहती है कि हम वैक्सीन को थोड़ा डिफर करेंगे. और गवर्नमेंट ऑफ इंडिया ने अभी रिसेंटली जस्ट फ्यू डेज बैक अब ये एडवाइजरी जारी कर दी है कि दोज हु हैड कोविड they will get their vaccine after 90 days.
90
So I
days.
think we
Okay.
90 days. So from the
Okay.
date of your diagnosis. So आपका date of diagnosis 22nd March था. So I'll consider that you will have after 3 months, that is 22nd June, you can have your shot,
ओके,
second shot,
so दैट्स अ
second
वेरी
shot.
गुड इन्फॉर्मेशन। तो 3 महीना जो है वो डायग्नोसिस के बाद में 3 महीना, नॉट फ्रॉम
Yes,
रिकवरी बट डायग्नोसिस के बाद में,
from the date of
फ्रॉम
diagnosis,
द
we
डेट ऑफ
can take a
डायग्नोसिस,
diagnosis.
आरटी-पीसीआर
Yes, yes.
पॉजिटिव होने से 3 महीने
Yeah.
बाद
Mm,
आप दूसरा शॉट ले सकते हैं, और
be-
कोविशील्ड ही लेना है उनको, नॉट
Of
एनी
course, of no other
no
vaccine.
other
Yeah.
vaccine, right? No other vaccine should be taken. So सवाल तो और भी बहुत सारे हैं डॉक्टर अरविंद। एक सवाल ये भी आया था, हमने स्टेरॉइड की बात करी, एक अनीता जी पूछ रही है कि फंगल डिजीज ऑफ आई आल्सो हैज बिकम वेरी कॉमन इन इंडिया। तो
Yes.
वही
Yeah.
म्यूकर माइकोसिस लोग रिलेट कर रहे
Mucus.
हैं कि जैसे डायबिटिक्स को ज्यादा होती है, जिनको स्टेरॉइड्स मिला है उनको होती है। इज देयर एनी अदर रीजन व्हाई दिस इज हैपनिंग? एंड अभी सेकेंड वेव में ज्यादा सुनाई दे रहा है, पिछले साल इतना नहीं सुनाई दिया था कि म्यूकर माइकोसिस कॉमन हो रहा, अभी कुछ ज्यादा बढ़ रहे हैं केसेस।
Yes, म्यूकोरमाइकोसिस इज ए प्रॉब्लम जो कि इस वेव के साथ में हमने ज्यादा देखा, सुना है, ज्यादा देखा है।
जी
अब ये इसमें बहुत सारे फैक्टर्स जो अभी सामने आ रहे हैं,
जी
बिकॉज as I mentioned कि we are still learning about other issues. एक तो it has been seen commonly with the diabetics, but even in non-diabetics also. अभी जो
अच्छा।
even non-diabetics,
हम्म,
uh, uh, even in the younger individuals also, it has been seen. Now, that is
ओके,
one thing.
ओह वाओ,
So
ओके,
that is one. So
हाँ,
we are probably having something related with the therapies only. So steroid is the one thing which is to be blamed to a great extent because
हाँ जी,
steroid का जो indiscriminate use जो है, that is one problem.
प्रॉब्लम है,
Secondly, it has been seen that it has been observed in hospitalized patient who received high flow oxygen.
ओके, ओके,
So something related with the oxygen tubings, maintenance of that, etc. That is
ओके,
also being blamed. Of course, the problems related with the diabetes is there, and
राइट,
some immunocompromised state caused probably due to COVID itself,
जी,
because COVID itself has an effect on the our neutrophils and the all these
राइट, राइट,
immune cells, etc. So
जी,
that is also probably to some extent responsible for this. So this has come up as a major problem in present time, basically.
ओके, या दैट्स गुड। अनीता जी, आई होप दैट आंसर टू योर क्वेश्चन। एक सवाल कंवल सचदेवा जी पूछ रही हैं कि कार्डियक अरेस्ट आफ्टर कोविड रिलीफ इज आल्सो इंक्रीजिंग, स्पेशली इन डायबिटिक्स, कैन यू प्लीज एक्सप्लेन व्हाई?
I think this is a correct observation that now for this we will have to understand how the coronavirus affects us. This SARS-CoV-2, it causes, besides infection of the cells and their proliferation in those cells, इसके
जी
साथ में जो inflammatory reaction जो शुरू होती है,
जी
वो शुरू होती है हमारे blood vessels की जो inner lining वाली जो cells हैं उनके ऊपर, जो
ओके,
एंडोथेलियल सेल्स हैं,
जी
उनमें इसमें स्वेलिंग शुरू होती है, एंड दैट कॉजेज ऑब्स्ट्रक्शन ऑफ द accumulation of cells, etc., and causes obstruction of those vessels.
जी
So, coronavirus में besides infection of the cells, जो inflammatory reaction है, उसमें
हाँ,
thrombosis, blood vessels के clotting is a major problem which is occurring.
आई
So
सी,
this endothelitis और जो 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 vascular जो event इसके साथ में
हाँ,
associated है,
जी,
that is to some extent responsible for the vascular problems
अरेस्ट,
like cardiac, etc.
जी,
Secondly, virus is known to affect the myocardial cells also. So myocarditis is also there.
तो हार्ट की
These
मसल को भी अफेक्ट कर रहा
heart के
है,
muscles को
और हार्ट की
this
जो ब्लड वेसल्स हैं वो भी अंदर से जैसे सूजन आ जाती है ब्लड वेसल में, वो
yes,
हो रही है।
yeah, जो जो छोटी वेसल्स है,
छोटी
माइक्रोवास्कुलर जो
वेसल्स में,
थ्रोम्बोसिस,
अच्छा
माइक्रोवास्कुलर
जी,
थ्रोम्बोसिस वगैरह है, तो इनमें हो रहा है, तो दैट इज व्हाई द अदर ऑर्गन्स आर अफेक्टेड लाइक ब्रेन, इवन किडनी, लिवर,
एवरी,
heart, they are all affected with the, even the skin
जी,
also shows the similar manifestations. So ये कारण है कि certain cardiac problems are being observed even in post-COVID state also.
राइट। तो उसमें ये एस्प्रिन और जैसे ब्लड थिन करने की दवाइयाँ हैं, जो ली जाती हैं, उनका क्या रोल हो सकता है किसी को आउट पेशेंट में? जैसे कोविड से रिकवर हो गए, तो उनको प्रोलॉन्ग पीरियड ऑफ टाइम कुछ आप रेकमेंड करते हैं?
जिनको जो सीवियर कोविड है और जिन उनको हमें और जिनमें कुछ मार्कर्स बढ़े हुए हैं लाइक डी डाइमर बढ़ा हुआ है और डिजीज भी सीवियरिटी ज़्यादा थी, उनमें हम यूजुअली ब्लड थिनर इन फॉर्म ऑफ एंटीकोएगुलेंट्स यूज करते हैं,
जी,
लाइक हेपारिन यूज करते हैं।
जी।
और उसके अलावा भी जो है ओरल जो एंटीकोएगुलेंट्स है, न्यूअर ओरल एंटीकोएगुलेंट्स जो हैं
हुँ,
उनको यूज करते हैं।
जी,
रिगार्डिंग एस्प्रिन और जो एंटीप्लेटलेट ड्रग्स हैं, इनकी कितनी एफिकेसी इस प्रॉब्लम में रहेगी ये कहना बड़ा मुश्किल है, बिकॉज
जी।
इसमें जो प्रॉब्लम जो हो रही है वो प्लेटलेट्स में नहीं हो रही है।
हुँ,
प्लेटलेट तो उल्टा कोरोना वायरस कम कर रहा है, पर
जी,
प्रॉब्लम जो हो रही है वो जो वॉज वेसल्स की सेल्स में हो रही है,
सेल्स में हो।
जहाँ पे ब्लड क्लॉटिंग को रोकने के लिए हमें एंटीकोएगुलेंट्स यूज करना पड़ेगा।
जी,
सो आई
जी,
थिंक हम ऐसे में यूजुअली इनिशियली 10-15 दिन के लिए लो मोलिकुलर वेट हेपारिन यूज करते हैं
जी,
एंड देन फॉलोड बाय ओरल एंटीकोएगुलेंट व्हिच is recommended up to 40 days, 31 to 39 days is the
जी।
time given. तो एटलीस्ट सब मान के चलिए 6 वीक्स तक जो है जरूर
6 वीक्स तक
जरूरत है।
ज़रूरी है और दैट्स अ
हाँ,
स्टैंडर्ड ऑफ ट्रीटमेंट राइट नाउ, तो वो
हाँ,
ये दे रहे हैं। तो कंवल जी ने फिर ये भी सवाल उठाया है कि स्टेरॉइड्स आर गिवन इन लार्ज अमाउंट, शुडंट दैट रिड्यूस द एंडोथेलियल
नो,
स्वेलिंग?
नो, नो, आई थिंक दैट इज एक्सपेक्टिंग टू मच फ्रॉम स्टेरॉइड्स। वही परेशानी है हमारी स्टेरॉइड्स के साथ में कि हम स्टेरॉइड को बहुत देखते हैं
हाँ,
कि वो कुछ भी कर सकता है। हमारे
जी,
जो टीचर थे, ही यूज्ड टू टेल इन बैक इन 70s
जी।
कि what is steroid? Steroid is a drug for desperate disease given by a desperate physician.
ओह हो!
That is,
ओके,
and for
दैट
a
मेक्स
desperate
सेंस,
patient,
दैट
and for a
मेक्स
desperate
सेंस
patient.
कि
So,
हम
but I
उसको
think but it won't reduce that swelling, please.
हाँ, हाँ, स्टेरॉइड विल नॉट हेल्प विद दिस एंडोथेलियल स्वेलिंग। उसमें आपके ब्लड को इतना थिन बनाना पड़ेगा कि उस नैरो जगह से भी वो ब्लड निकल कर चला जाए। क्योंकि वो स्वेलिंग तो जब कोविड का असर खत्म होगा, धीरे-धीरे तो वो अपने आप कंट्रोल में आएगी स्वेलिंग, तो उसके लिए कोई ख़ास दवा की ज़रूरत नहीं है, सिवाय एंटीकोएगुलेंट्स के जो ब्लड थिनर जो मेडिकेशन है। कमल जी बहुत अच्छा सवाल आपने पूछा है। सो एक मैं आखिरी सवाल आपसे पूछना चाह रही हूँ अरविंद जी, कि ये जो म्यूटेंट है वायरस, इसका ट्रीटमेंट और जो एक्चुअल जो रेगुलर जो ओरिजिनल कोविड है, उसका कोई ट्रीटमेंट फ़र्क है या वही सेम ट्रीटमेंट दिया जाता है दोनों में?
लकीली जो ट्रीटमेंट है फॉर म्यूटेंट इज आल्सो सेम।
ओके,
ओनली एक जगह पे कुछ थोड़ा सा डिफरेंस जो हमने पढ़ा है, बिकॉज अभी हमारा एक्सपीरियंस उसमें नहीं है, वो है जो मोनोक्लोनल एंटीबॉडी जो फर्स्ट वीक में दी जाती है
जी,
फॉर द फॉर द डिजीज, माइल्ड डिजीज, उनमें कहते हैं कि जो उनका इफेक्ट ऑन म्यूटेंट्स इज स्लाइटली डिफरेंट देन द नॉर्मल नॉर्मल वायरस। ओके, बट
ओके,
इन जनरल द मैनेजमेंट प्लान्स, द पैथोफिजियोलॉजी या जो डिजीज जो वायरस म्यूटेंट्स कर रहे हैं वो सिमिलर वे में कर रहे हैं,
जी।
इसलिए उनका जो मैनेजमेंट प्लान है वो सेम ही रहेगा।
और सेम ही
ऐसा
होता है, तो कोई ज़रूरी नहीं है कि म्यूटेंट हो तो उसको, क्योंकि आमतौर पे तो पता चलाना भी मुश्किल है कि ये म्यूटेंट से हुआ है इन्फेक्शन या अ, ओरिजिनल कोविड वायरस से हुआ है। तो ट्रीटमेंट बिल्कुल गिव एंड टेक
सेम
सेम सेम ट्रीटमेंट ही होता
सेम।
है। सो मेनली तो इसमें ऑक्सीजन की है और इन्फ्लेमेशन अगर है तो स्टेरॉइड्स, एंटीबायोटिक्स का आपके हिसाब से कोई रोल नहीं है। प्रोफिलैक्टिक एंटीबायोटिक्स करके काफ़ी लोग देते हैं कि सेकेंडरी इन्फेक्शन को प्रिवेंट करने के लिए, तो
आई थिंक जो इनिशियल फर्स्ट वीक में प्रोफिलैक्टिक यूज एंटीबायोटिक या एंटीवायरल्स का नहीं है यूजफुल,
हुँ,
बट सेकेंड और थर्ड वीक आफ्टर वी हैव गिवन स्टेरॉइड्स तो बहुत कुछ लोगों को कुछ इन्फेक्शंस होते हैं। एट
जी,
दैट टाइम one may have to use antibiotics basically.
जी,
Uh, जो ओरल एक एंटीवायरल भी यूज में आती है, फेविरापिर जो है,
हाँ जी, वो भी
उसका
काफ़ी
वो
यूज़ हो रही है
वो
एंटीवायरल।
काफी यूज हो रही है, बट स्टडीज हैव नॉट प्रूवन इट्स वर्थ बेसिकली।
हुँ।
वो केवल रशिया में अप्रूव्ड है, जापानीज स्टार्टेड इट, बट
हुँ,
हमारे यहाँ पे भी परमिटेड है एंड इट इज बीइंग यूज्ड आल्सो, बट
हुँ,
we do not find any impact because
आई सी,
of its side effect profile, etc. It is better to
राइट।
avoid it, basically.
आइवरमेक्टिन का मैंने बहुत सुना है, और ये इंडिया में, कि ये अभी
Yes.
एक कॉकटेल थेरेपी का एक पार्ट है कि आइवरमेक्टिन भी बहुत यूज़ कर रहे हैं। तो आइवरमेक्टिन क्या है और इसका किस बेसिस पे कोविड में यूज़ होता है?
Ivermectin is primarily an anti-helminthic drug, but long back it was shown to have antiviral effect. जो
जी।
हमारी जो previous studies में भी जो है for other viruses also,
हुँ,
it was shown to have antiviral effect.
जी,
देन एक स्टडी ऑस्ट्रेलिया से पब्लिश हुई थी जिसमें उन्होंने आइवरमेक्टिन का इफेक्ट कोविड सार्स कोवी 2 पे भी बताया था,
जी।
बट इन दैट केस द डोज यूज्ड फॉर आइवरमेक्टिन वाज वेरी हाई, जो कि हम
वेरी हाई डोज़।
यूजुअली यूजुअली हम इतना सब एडमिनिस्टर नहीं कर पाते हैं
जी,
पेशेंट को। फ्रॉम देयर देन कुछ जो है क्लिनिकल स्टडी जो आप कह लीजिए बांग्लादेश से पब्लिश हुई, जिसमें उन्होंने डॉक्सीसाइक्लिन और आयोमेक्टिन के कॉम्बिनेशन को यूज किया है, then they
ओके।
showed clinically a good response. From that
हुँ,
time onwards, the use of this combination has been going on.
डॉक्सीसाइक्लिन,
No,
आइवरमेक्टिन।
doxycycline
ओके,
with ivermectin. Now,
ओके।
the problem is that neither it has been proven. Uh, People then use with the statement that, okay, it's not expensive, it is not going to do much harm to give it for 5 days,
जी,
so why shouldn't we do it? So that is the way the practice is going on, basically.
हाँ जी,
उसी
कि
की वजह से
जितना
यूज
जिस
हो
पे
रहा
हाथ लग सकता है हमारा, वो
है।
हम
कुछ करने का,
यूज़
हाँ, कुछ तो
कर रहे हैं।
करें, अदरवाइज कुछ भी नहीं कर रहे हैं तो इट इज
कुछ भी
बेटर।
नहीं कर रहे हैं तो
So
राइट।
that's what is happening with COVID. कि हम every day we are learning something new
जी,
about the
बिल्कुल।
disease, about its manifestations, about management,
जी,
etc.
जी। बट नथिंग बीट्स प्रिवेंशन। आई थिंक प्रिवेंशन इज़ बेटर देन क्योर। तो
Then cure,
उस उसके
nothing
लिए
beats.
तो
Yes.
हमको सिर्फ़ यही करना पड़ेगा कि इसको, मेरे हिसाब से कोविड को हम जंगल की आग मान सकते हैं, कि इट्स लाइक अ वाइल्ड फायर। और जो हम
Yes.
इंसान लोग हैं, उसमें वो तिनका होता है सूखा हुआ, उसकी तरह से हैं। तो आपको अपना
Exactly.
प्रोटेक्शन करना है। आग तो जब बुझेगी तब बुझेगी, वो आपको अपने को तिनका समझ के उस आग से बचाना है। सो उसके लिए आप क्या कर सकते हैं कि आप मास्क पहनिए, उससे आग से दूर रहिए, सोशल डिस्टेंसिंग बनाए रखिए। जितने ज़्यादा कोविड पेशेंट्स के कॉन्टैक्ट में आप आएँगे, तो आपका लोड उतना ही ज़्यादा होगा, एक्सपोज़र लोड। तो उससे डिज़ीज़ के चांसेस भी ज़्यादा बढ़ेंगे, और इसीलिए हेल्थ केयर प्रोफ़ेशनल्स को ख़ास तौर पे केयरफुल रहना चाहिए। तो अ, और वैक्सीन जो आया, वैक्सीन से भी काफ़ी फ़र्क पड़ना चाहिए, डॉक्टर अरविंद।
Yes, I think we are waiting for that, और
जी,
काफी होपफुल हैं कि वैक्सीनेशन जो है वो बहुत ही मददगार
जी,
साबित होगा हमारे लिए,
जी,
एंड दैट इज व्हाई वी ऑलवेज अर्ज एवरीबॉडी टू गो फॉर वैक्सीनेशन,
जी,
बिकॉज एक हमारे यहाँ वैक्सीन वैक्सीन हेजिटेंसी has been there, was there, now things are changing,
जी,
but but I think vaccination is the only light for
राइट,
us,
राइट। हाँ, वैक्सीन
basically.
हेजिटेंसी यहाँ पर भी काफ़ी है, यूएसए में भी काफ़ी देखने को मिल रही है। बट फॉर्च्यूनेटली, वी फॉर्च्यूनेट कि हमारी स्टेट में करीब वी आर रीचिंग अप टू 60% वैक्सिनेशन रेट अभी हो चुकी है। We
Okay,
have
that's
a team of like 11,000 professionals who are working day and night and giving out vaccination. तो काफ़ी प्रमोशन भी चल रहा है इसलिए। बट दैट इज़ द वैक्सीन के बारे में हेजिटेंसी लोगों को बहुत होती है, लेकिन वैक्सीन जो है उससे जो वायरस, लोग ये कहते हैं कि फिर भी बीमार हो रहे हैं लोग, वैक्सीन लेकर भी, तो फिर वैक्सीन की यूटिलिटी क्या हुई? तो lot of factors play into role also। तो लोगों को ये हम एजुकेट कर सकते हैं कि वैक्सीन के बाद में जो इलनेस है वो इतनी सीरियस नहीं होनी चाहिए, और जिनको अगर हो रही है तो मे बी दे वर ऑलरेडी सिक बिफोर दे रिसीव द वैक्सीन, और या फिर उनके कोई अंडरलाइंग हेल्थ प्रॉब्लम रही होगी जिसकी वजह से उनका जो वायरस का जो एक्सपोजर था दैट ओवर पावर्ड द प्रोटेक्शन फ्रॉम द वैक्सीन.
Yeah, definitely. And many times people relate their disease with vaccine, but that is probably because of that they left the precautions while going for vaccine. सो हमने जैसे आप काफी नरेशन सुनेंगे कि हमने एक पर्टिकुलर डे वैक्सीन लिया एंड आफ्टर 10 days I got the disease. That is because when they went for the vaccination, probably they could not maintain the safe distancing from the people. They did not have their mask on.
हाँ जी.
So all these things they are responsible for
हाँ जी.
getting infection from the
कॉमन
vaccination
सेंस.
site.
राइट राइट, ये भी बहुत जरूरी है, और कई लोग घर में कोई बीमार है तो फटाफट वैक्सीन लेने चले जाते हैं कि हम तो कम से कम लगवा लें, बट मे बी यू आर ऑलरेडी एक्सपोज्ड, सो दैट विल नॉट बी अ गुड टाइम कि अगर आपके घर में किसी को कोविड हुआ है तो उस वक्त वैक्सीन न लगाएं, थोड़ा इंतजार करें, अपना क्वारंटीन खत्म करके फिर आप लगवाइए, ताकि आप औरों को भी एक्सपोज नहीं करेंगे और आपका भी प्रोटेक्शन होने का चांसेस ज्यादा रहेंगे. कार्तिकेय त्रिपाठी जी एक सवाल पूछ रहे हैं, ऑक्सीजन कॉन्सेंट्रेटर की जो रेस हो रही है अभी, there is a race on these days to acquire oxygen concentrators for home use. The rationale is that having this machine will help in avoiding a hospital visit, at least for a bit. Is that true?
Yes, I think it's going to buy some time in the progress of the disease, in the setting of the disease. When you look at the natural course of the disease, a mild illness then progresses to a severe illness with lowering of the oxygen levels.
जी.
Now, presence of a oxygen concentrator at home can buy us some time to maintain oxygen saturation in these milder cases between, say, those who have a dip in saturation and they require just oxygen of 1 or 2 liters, 3 liters, because usual oxygen concentrators would have a limit of 5 liters. Now, there are few which are available at 10 or so, but usually it's 5 liters. So those patients can buy some time with the presence of oxygen concentrator at home, basically, because before, in case if they improve from that point onwards, it's good. But otherwise, before going to a hospital, at least they have got some respite.
It will buy them some time. So it's a good idea in a way. जो रेस चल रही है कि कॉन्सेंट्रेटर मंगवा लें, काफी यहाँ से भी काफी जा रहे हैं, इंडिया में भी काफी हैं, तो लोग ऑनलाइन ऑर्डर भी कर रहे हैं ऑक्सीजन कॉन्सेंट्रेटर. तो अगर मिल जाए तो बहुत अच्छा है. तो
इसमें जो प्रोन पोजिशनिंग का भी हम यूजुअली बात करते हैं.
That's a good point. Yes.
हाँ, so that is also important because in home management we do ask people to practice prone positioning and breathing exercises, of course, with that. So that would also help us.
प्रोन पोजिशनिंग के बारे में अगर आप कुछ और बता पाए डॉक्टर अरविंद, अगर प्रोन मतलब जैसे पेट के बल लेटना,
पेट के बल लेट के हम जब जो हमारा लंग है वो उसमें बेसिकली जो फिजिक्स जो लंग की है वही इम्पोर्टेंट है. एंड इसमें अगर हम देखें तो 2 इश्यूज चलते हैं. एक तरफ तो ब्लड सर्कुलेट करता है जो कि हमारा अनऑक्सीजनेटेड ब्लड हार्ट से लंग में आया और वहां से ऑक्सीजनेट होके वापस हार्ट में गया. सेकेंडली एयर जो है जो बाहर वी ब्रीथ इन ऑक्सीजन जो रिच एयर को ब्रीथ इन करते हैं और जो कार्बन डाइऑक्साइड है वो एक्सचेंज होके बाहर आ रही है. नाउ पर लंग के सारे एरियाज में हर समय एयर नहीं जा रही है बिकॉज कुछ एरियाज जो है जो डिपेंडेंट एरियाज हैं. जब हम सीधा लेटे हैं तो हमारा जो लोअर पार्ट ऑफ लंग है और उसका जो बेस है उसमें ऑक्सीजन और उसमें एयर उतना नहीं पहुंचती है. तो इन केस इफ यू विल लाई ऑन प्रोन पोजीशन, तो जो हमारी जो फिजिकली जो हार्ट की पोजीशन चेंज होती है,
हाँ,
लंग का जो पार्ट ऊपर आ जाता है बेस वाला, तो दे विल रिसीव मोर एयर, एंड
हाँ,
दैट्स व्हाई जो एयर एक्सचेंज जो है वो थोड़ा इजी हो
हाँ
जाएगा.
जी।
सो दैट इज व्हाई
हम्म,
प्रोन पोजीशन में अगर हम ब्रीथ करें तो दैट विल
जी,
हेल्प अस.
हाँ
इसके
जी।
लिए व्हाट हैज टू बी डन इज जस्ट हैज टू लाई ऑन द स्टमक. वन
स्टमक।
कैन यूज one or two pillows to make
हाँ
themselves comfortable,
जी,
and just normal जैसा ब्रीथ कर रहे हैं वैसे डीप ब्रेथ करते रहें
जी,
बराबर. तो दैट विल हेल्प अस.
हाँ जी।
और जो प्रोन नहीं कर पाते हैं, दे कैन इवन डू टर्न ऑन वन साइड एंड अदर साइड. दैट विल
अच्छा,
आल्सो हेल्प अस.
अच्छा।
दैट
तो
इज
अगर
आल्सो
पेट के जैसे ये हार्ट है और उसके ऊपर लंग है, तो अगर लंग ऊपर है तो उसमें हवा ज़्यादा जाएगी,
yes
बजाय इसके कि
comparatively.
हम जैसे यूँ लेटेंगे तो लंग नीचे रहेगा।
Yes,
और अगर
I think that is a better
साइड
explanation.
में भी लेट कर आप पोज़ीशन चेंज करके भी आप अपना लंग की जो ऑक्सीजन लेवल है वो बढ़ा सकते हैं। दैट्स अ वेरी गुड पॉइंट, दैट्स अ वेरी गुड पॉइंट। एक क्वेश्चन किसी ने शुगर के लिए पूछा था कि अभी जैसे म्यूकरमाइकोसिस काफ़ी चल रहा है और स्टेरॉइड भी ले चुके हैं, कोविड से रिकवर हो गए हैं, तो दे आर ट्राइंग टू अवॉइड शुगर इन देयर डाइट, व्हिच आई थिंक अवॉइडिंग शुगर इज़ ऑलवेज़ अ गुड आइडिया कि बहुत ज़्यादा शुगर लेनी भी नहीं चाहिए, बट मे बी वी कैन अस्यूम कि ये उसमें इन्फेक्शन को रोकने में भी मदद कर सकती है।
Yeah, I think sugar control is always better, और that too in यहाँ की जो कोविड की circumstances में sugar control is very important. And
जी,
those who have even normal sugar, उनमें भी कोविड has been shown to increase blood sugar levels, because
जी,
कोविड जो है वो हमारे पेनक्रियास में भी इन्फ्लेमेशन करता है, और it is known to increase blood sugar levels. So it is a good idea to restrict sugar at this particular time.
राइट,
Other drugs like steroids would also cause the problem.
जी।
So, and there are reports of diabetes developing after COVID also.
Ji,
So,
ji. And I have seen that in my patients also. Yes, diabetes
so,
developing
so,
after COVID. A lot of things that we don't know that are just evolving. अभी आए दिन
yes,
कुछ ना कुछ नई हमको खबर मिलती रहती है कि ये भी हो सकता है, वो भी हो सकता है। तो
I think we are learning, because अभी आप ये देखिए कि in post COVID patients uh, having irregular fever of no reason, after
oh,
even after 6 weeks, 8 weeks, they
oh,
say suddenly
it
their temperature rises and then goes down.
then goes down
So,
for no reason.
for
हाँ,
no reason. So
हाँ,
that's why we are learning, because we'll have to see what is happening to them really.
हाँ, हाँ,
So
that is true. तो हर दिन कुछ ना कुछ
and
नई इन्फॉर्मेशन
yeah.
मिलती जाएगी।
And I think the medical facilities will have to be prepared for all these post-COVID patients,
जी,
because may it be psychological rehab problem, or rehabilitation for respiratory rehabilitation, etc.
जी।
So I think healthcare facilities will have to start preparing themselves for that also.
राइट, राइट। अभी लोगों में थर्ड वेव का भी डर काफ़ी लगा हुआ है, अभी तो सेकंड खत्म नहीं हुई एंड दे आर टॉकिंग अबाउट द थर्ड वेव आल्सो।
Yes.
तो होपफुली उसके पहले वैक्सीनेशन जो है अ, वो काफ़ी लोगों में हो जाएगा। टारगेट विल बी 70% ऑफ पीपल शुड बी वैक्सीनेटेड टू क्रिएट हर्ड इम्यूनिटी, कि
Yes.
मास इम्यूनिटी हो जाए। तो लेट्स होप दैट
Yes. No problem.
राइट, राइट। सो डॉक्टर अरविंद माथुर, आपका बहुत बहुत धन्यवाद। मैं आई फील ऑनर्ड दैट यू केम ऑन द show today to educate us on COVID, which is a burning topic these days. Everybody is just talking about COVID. I think 99% of the conversation is about the pandemic. So बहुत आज एजुकेशनल इंफॉर्मेशन हमें मिली है, तो अगर हमारा गुड फॉर्चून हुआ तो आप फिर से हमारे शो में आएंगे, एंड थैंक यू सो मच फॉर
Thank you very much, Sangeeta ji, for all the opportunity which I got today, and it is always pleasure and to have discussions with you. And Of course, we have all been enjoying what you have been offering during the pandemic time of relaxing people with your music. Thank you. Thank you very much.
Thank you so much. It's an honor. And again, मैं अपनी ऑडियंस को बताना चाहती हूँ कि नथिंग बीट्स प्रिवेंशन, और आप अपना मास्क लगा के रखिए, सोशल डिस्टेंसिंग बना के रखिए. कोई हार्म नहीं है, और वी डोंट नो हाउ लॉन्ग विल दिस पेंडेमिक लास्ट. तो अपना बचाव आपको खुद करना है. वैक्सीन लगाइए. जो भी do not let the politics come in the way of your health. Whatever people may say, whatever you may hear, just trust your instinct. Trust your instinct कि आपको अपना बचाव खुद करना है. मैं एक एग्जाम्पल दे सकती हूँ कि जो वैक्सीन है, जैसे मैंने बताया था, जंगल की आग है और आप एक लकड़ी का टुकड़ा है तो आप जल सकते हैं. जो वैक्सीन है वो आपको एक गीली लकड़ी बना सकता है. जैसे भीगी हुई लकड़ी होती है उसमें आग कम पकड़ेगी, पकड़ सकती है, आप थोड़े से जल सकते हैं लेकिन पूरे नहीं जलेंगे. तो ये इंफॉर्मेशन जो है, एजुकेशन हमारे लिए बहुत ज़रूरी है. और वैक्सीन जो है, वैक्सीन आपके बॉडी में कोरोना क्या होता है, वो आपके बॉडी को इन्फेक्ट करता है बाय मल्टीप्लिकेशन. जब आपकी बॉडी में जाता है तो उसके वायरस है तो उसके मिरर कॉपीज आफ्टर कॉपीज बनती हैं, इससे आपकी सारी बॉडी इन्फेक्टेड हो जाती है. जो वैक्सीन है उससे जो वायरस का जो प्रोपगेशन है वो रुक जाता है. तो इसलिए आपको उससे प्रोटेक्शन मिलता है. तो होपफुली वी विल सी एन एंड टू द पेंडेमिक वेरी वेरी सून. थैंक यू सो मच डॉक्टर साहब. थैंक यू. और ये रिकॉर्डिंग रहेगी ऑन यूट्यूब एंड द फेसबुक. तो आप बाद में भी, जो लोग लेट ज्वाइन कर रहे हैं उनको बाद में देखना हो तो प्लीज डू वॉच इट. इट्स वेरी इंफॉर्मेशनल. एंड विद दैट, थैंक यू सो मच.